Sometimes people need IV access for different reasons, antibiotics or chemotherapy, and there's a couple ways that we can give them that access. One of them is called a Groschon tunneled catheter, and that's a catheter that enters a vein in the body, like say the jugular vein for instance, and then it's tunneled under the skin and comes out over your chest area. Because of the tunnel, since it travels under the skin at a distance before it comes out, it makes it less likely that the catheter will get infected. Even more under the skin is what's called a port. A port is typically used for chemotherapy, sometimes for other reasons, but in that situation, much like the Groschon catheter, the catheter is tunneled under the skin, but instead of coming out, there's actually a reservoir about the size of maybe half a golf ball, and it is underneath the skin, so it's completely covered by skin, and the nurse who accesses it can actually feel it under the skin and then put a needle through the skin through a rubber diaphragm into the port, and then they'll have access to the bloodstream. When they're done using the port, they simply pull the needle out, and now there's nothing coming out of the body. This is a great way to maintain long-term access to the central veins, but it really reduces the risk of infection because between the time it's accessed, there's nothing coming out of the body.